Hey, good afternoon, guys. Can you hear me okay? Yeah. I'm pretty loud. I'm the director of the Cancer Society of Greenville County, and we serve over 4,000 patients every year who have cancer. And we help them directly by helping to pay for medicines, to help pay for any kind of transportation they may need to and from treatment. We pay for emergency assistance. We also help them with free nutritional supplements, free diapers if their cancer causes them to need that, free medical equipment. We also have support groups and free one-on-one counseling. And then a little bit about who we are as education. We like to do outreach in the community and do our best to try to prevent cancer. About a year ago, on September 1st, we launched the Cancer Association of Pickens County, which is doing the exact same thing that the Cancer Society of Greenville County does. Before we launched this organization, there were no direct services for cancer patients here in Pickens. Right. Amen. And we heard that loud and clear. So we got together with some residents here and we made that happen. And I also want to thank the hospital. I know we're sitting here, but without their support, we would not be able to run this program. And Chris is here in the back, who actually runs the program for us. Yay, Chris! She's a godsend. Everything is volunteer driven. And so if you know anyone that has cancer, please send them here. They are open Tuesdays and Thursdays, 10 to 1. 10 to 1. And then you can always call our Greenville office as well.
Where are they located?
They're located in the foundation room right when you come in, beside the bank, the credit union. And you can always ask the front desk. Those ladies can tell you where to go. But if you know anyone that has cancer, please send them to us. That's why we're here. We want to help. If you can spread who we are to your church, to other organizations, please do so, because we want to serve as many people as we possibly can who have cancer. And we know they need that help. And we have the dollars to help. So please send them our way. But today I'm here with my education hat on, and I want to talk to you guys about cancer prevention. Scary subject. To start, we'll look at some cancer facts. In the United States, 1 in 2 men and 1 in 3 women will develop a life-threatening cancer during their lifetime. That's a pretty scary statistic. In South Carolina, over 29,000 new cases are diagnosed each year, with 700 right here in Pickens County. That's a big number. And not only is this disease very scary, as we know, it's also really expensive. And a lot of us aren't prepared for the day we get cancer, because we hope we won't. But the estimated cost of cancer in Pickens County annually is about $101 million. So that's crazy, astronomical. So we want to prevent it. We don't want people to get cancer at all, right? So what can we do to try to prevent cancer? Also, a little known fact is that 2/3 of all cancers are preventable. So 1/3 is not. So if you look at it that way, if we follow the things we're going to talk about here today, we could possibly prevent 2/3 of those cancers. So when you're looking at the continuum of cancer care, it starts with prevention, screening, treatment, and then care. So how are we going to care for patients? When you look at prevention, that may be smoking cessation, that may be healthy lifestyle, which we'll get into in a little bit. An example of a screening is a mammogram. And then treatment could be chemo, it could be radiation. And then we look at survivorship. What happens after cancer? What's the lingering effects? How do we move on with our life after the big C word? Whoops, not sure what's happening there. Okay, why do these matter? I'm gonna go through these. So when you talk about prevention and screening, if we catch cancer at a stage 1, at an early stage, the treatments are a lot easier and they're not as evasive. There's less side effects, there's better chance at survival and better chance for a cure, and it saves dollars. So that's why prevention is important, so that we don't have to go through the C word at all, or we catch it really early so that it's not as painful and not as costly. I'll go through all these. Screening strategies. For the most part, they're painless, not a shot, which is good. It's precise, it's profitable. There are multiple kinds of screening. There are blood tests, there are imaging, there are procedures, and even a routine physical with your physician is a kind of screening. because at that time you're getting blood work done, you're talking about changes, hopefully with your physician. And then you guys can be your best advocate, really knowing your body. No one knows your body like you do. So being on top of your body, understanding if there's a change, and then calling a doctor once there is a change. I can't tell you how many people come in and sit across from us. They've been diagnosed with a stage 4 cancer, and they say, you know, I found this lump in my breast a year ago, but I was too scared to go to the doctor. I mean, that is just not acceptable. That person could have gone to the doctor at that time, and maybe it was only stage 1 or stage 2. So it's really important that not to be scared and to confront what's happening in your body and to ask your doctor about it. And if you're not happy with what the doctor says, you can always ask another doctor. So which ones are the most important? Amen. Amen. So let's talk about mammograms. We're going to talk about some of the screenings that we know work. There are a lot of screenings out there. The ones we're going to talk about today are the ones that have been studied and really work. So mammograms. This is an x-ray of the breast tissue in women, and it shows masses that are suspicious for cancer. Now, just because you get a mammogram, how many of you have gotten a mammogram this year? Let's raise your hand. Good. Everyone needs to go get one. And a lot of times we get false positives. A lot of time they ask us to come back because they found something, and 9 times out of 10, it's a cyst that's benign. But we have to know, because sometimes it may not be a cyst that's benign, and we got to treat it. So, mammograms, do they really matter? Absolutely, absolutely. There was an international workshop on screening for breast cancer in 1993 where they actually studied mammograms and if they worked. They looked at women 50 to 69 years of age. Breast cancer specific mortality decreased by 1/3. So if these women had gotten a mammogram, then their mortality decreased by 1/3, which is great. So that shows these actually work. So this is a scary statistic. Out of that study came if 3 women who don't get mammograms eventually die of breast cancer, one of them would have lived by simply doing a mammogram. Now, you can say they're costly, you can say they're expensive. They are covered by Medicare, they are covered by Medicaid, and they're covered by all insurance. We also are doing a Prevention and Wellness Palooza event where we're offering free mammograms. It's this Saturday. The information is at your table. If I didn't give you enough, I have extras right here. So grab one. And once again, help us spread the word, because the more people we can screen, the more healthy our community will be. Now, this event is in Greenville, but we do have free transportation. So if transportation is an issue, the Easley Fire Department will pick you up and will drive you to and from the event, which is a great partnership. So yay, Easley Fire Department. Okay, so when to start mammograms? 40 and over. And then there's loose, and they should happen every year. So if you're 40 or over, they should happen every year. If you're 65 and over, every other year. So go every 2 years. So women, it's important to remember to pick a certain date and do that every time, every year, so that you don't forget. Maybe it's your birthday, maybe it's October because that's Breast Cancer Awareness Month. Just pick a time so that you remember, oh, I didn't get my mammogram, I need to go do that. And then mammograms are not needed for women with a life expectancy under 10 years, and don't just use your breast exam. But I do want to talk about breast exams because they're really, really important, and that goes back to knowing your body. So maybe once a month when you're in the shower or when you're laying down, examine your breast. If you need to know how to do that correctly, I've got some cards here today. Just see me afterwards and I can give that out to you. And just if anything is different, if the color's different, if you feel something, anything's different at all, call your doctor immediately. Okay, so that's breast. Now let's move on to the colon. A colonoscopy is a small camera that's inserted into the colon to look for cancers, precancerous polyps, bleeding ulcers, or any other abnormalities. The best thing about a colonoscopy is it's a screening tool, a diagnostic tool, and a treatment all in once. So if they go in and you're getting your colonoscopy and they find something, they can take it out, they can biopsy it, they can do they can start treatment right then and there. So it's not something you have to wait for and come back. It's immediate. Since 2002, people getting screened increased, people dying decreased. So once again, looking at data, we know that if people will get screened, there'll be a direct correlation in decreasing the loss of life. So we know colonoscopies work. Now, the one thing that I would say is when you go to get a colonoscopy, just because they find something, it doesn't mean that it's cancerous. It could be diverticulitis. It could be a lot of different things. But the moral of the story here is we don't know unless we get screened. Now, at the age of 50 is when it's recommended that you get a colonoscopy. So every 10 years after the age of 50. And based on findings at your first colonoscopy, it'll dictate your next screening, but typically it's every 10 years. Unless they found some precancerous polyps, they may have you come in 2 years or 3 years, or maybe in the next year to do another one, so they can take another look. But things you can do when you're not having a colonoscopy is know your risk factors. Look at a change of bowel habits lasting more than a few weeks. So just because something bad happens one time, wait a couple of weeks to see if it continues to happen. A feeling of having to have a bowel movement that doesn't go away even after doing so. Rectal bleeding, dark stools, or blood in your stool. That's a huge sign. But once again, that doesn't mean you necessarily have cancer. There could be other things going on that aren't the bad C word. But it's important to know that. Stomach discomfort, including bloating or steady abdominal pain. Unexplained weakness or fatigue, and then unexplained weight loss. If you have any of these factors, it's important to call your doctor, and they'll talk about next steps. Any questions about colonoscopy? I went through that kind of fast. Okay, we'll talk more about that in a little bit. Lung cancer screening, that's our last screening tool that's really proven and really works. The National Lung Screening Trial was released in 2011, and they looked at smokers from the age of 50 to 70 years of age. And what they did is they did a spiral CT scan, which is a lower radiation dose. It's much lower than a normal CT, so it doesn't put as much harm on your body. The results of this screening is it decreased the chance of dying from lung cancer by 20%. So that's not huge numbers, but 20% is 20%. So by going and doing this CT, you could be saving your life or catching lung cancer earlier. In February, it was just approved by Medicare to cover this screening. So it's totally free of charge. But there are some parameters. So it recommends annual screening for lung cancer with the low-dose scan, like I mentioned, in adults age 55 to 80 who have a 30-pack year smoking history and currently smoke or have quit within the past 15 years. So if you're 50 years old and you stopped smoking when you were 35 and you smoked 2 packs a day for 15 years before that, then you need to get that screened. Or if you smoked 1 pack a day for 30 years. You see what I'm saying? It's got to be 30 pack year history. So if you did 3 packs a day, whew, you better be in that screening right now. But it's totally free of charge. So, just call and get these things done because it could save your life or it could show you that you need some treatment. Now, there's also blood tests. So we've talked about the screenings that are recommended that we know work. That was the mammogram, the colonoscopy, and the lung cancer screening. Now let's talk about, blood tests. So unfortunately, there's no just blood tests that you can take that'll test for all cancers and you know what's happening in your body. Wouldn't that be nice? Originally, it was thought that could happen, but the data's just not there to prove that. The main blood tests that happen, that we'll talk about in a minute for cancer, are called tumor markers. And what that blood test looks for is proteins or sugars that are shed by your cancer cells. So that sometimes is picked up in the blood and may indicate cancer. But it costs a lot of money to do these blood tests. And you can't do them every month, you can't do them every year. So they don't really save lives. It's not a proven. Yes, do you have a question?
Well, yes, I recently had two blood tests that are not covered by Medicare that cost $95 each.
Wow.
And it was in conjunction with getting an ultrasound. And supposedly it tells the doctor if there's any cancer in your system.
Right. But what did it come back okay?
Yeah.
Oh, good. 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 So here are some of those tests. I wonder if it was one of these. Oh,
I think it's that first one.
It was ovarian.
CA.
Yes.
25.
That one has the most false positives. I will tell you.
False positives.
Yes. I've had that myself done. So examples of some of the blood tests are the ovarian cancer, which is the CA-125. In fact, a lot of GYNs don't do this anymore because there are so many false positives.
Well, it was required by the GYN.
And every doctor's different. So every doctor could be different. If your doctor says to do it, do it. But don't go to your doctor and ask for these because they're not always right. Yes?
I have the first one
Uh-huh.
because it's in the family.
Mm-hmm.
And it came back saying that I wasn't a carrier, or I wasn't positive, wasn't a carrier. Is that still good?
That's good. That's good. The problem with these are false positives. So if you're getting a negative, that's great. But they do cost money.
$95.
$95, and insurance doesn't cover it
Why doesn't Medicare cover it?
because it doesn't save lives. And we'll talk about that in just a minute. There's no proof that that saves lives because there's so many false positives. But it does rule it out. So if you have a family history, if you have symptoms, which when you talk about ovarian cancer symptoms, we all have them every day. It's bloating. There's not a lot of symptoms for ovarian cancer. But if your doctor recommends it, then go forth. Big one is PSA, prostate cancer, for the men in the room. Lots of controversy over that, which we'll talk about in just a second. And then there's a breast cancer. No one really gives that blood test anymore because you have mammograms and you have screening tools that work. And then there's a colon cancer and lung cancer blood test and the pancreatic cancer. Once you're doing these and the symptoms are there, you've already got full-blown cancer. So that's the problem with it, is it's not really a screening tool. It just really helps the doctor to know, yeah, there's some cancer present before they go in and do surgery to do a biopsy, if that makes sense. Okay. So here's your answer. Why don't people get this all the time? Cancers don't always shed, and sometimes other things can cause the test to be falsely elevated. There's so many things going on in our body that it can make a blood test come back positive, and then that leads to more things that you have to go through, whether it's surgery or it's a biopsy, and just to find out if you have cancer. So unnecessary scans and biopsies. Most have never been shown to make people live longer. So that's the kicker right there. Because once again, once they find it through these blood tests, you already have cancer and you're going to go through treatment for the most part. So, but there's no data that shows that people live longer. So if you're a drug company and you're trying to make money and you have people willing to pay for it and they want to pay for peace of mind, you can pay. But the data shows for the masses, it doesn't save lives. So it's not going to be covered by the government, if that makes sense. I mean, it does, but it doesn't.
One other thing, I didn't realize that I had a cyst on my ovary, except I had an MRI for some other problem.
Yep.
And then, of course, I had an ultrasound. But how are people need to do some kind of test like this, screening,
I agree.
because otherwise I had no pain.
I
I
agree.
would have never known I had this cyst.
I agree. I had a 15-pound cyst just recently removed. Same exact thing. Had no clue. Yes.
I was just going to say, I do medical transcription, and I see ovarian cancer in women our age all the time.
Absolutely.
You don't get away from it just because you get older and go to the menopause.
That's right. You don't. That's a great point. She said that just because you get older and you go through menopause, you're still at risk for ovarian cancer. It doesn't go away. So that's a great point. Yes.
Right now, isn't the PSA for prostate cancer very controversial?
Very controversial. Yes. There's so many false positives. So then that leads to surgery, or that leads to ultrasounds. It's really up to you to look at the pros and cons, and we'll hit PSA in just a second. But to go back to ovarian cancer is horrible. There's no screening for it. There's no test. We just hope that there'll be more research to do that, to find it. That's all I can say. It stinks. It's horrible. So really these, as I mentioned, were tests developed for people with known cancers to follow their response to treatment. So an example of that would be, let's say you're diagnosed with ovarian cancer, you were given that CA 125, your levels were elevated. Once you start chemo or they do radiation, your doctor may give that to you again to see if your treatment's working. That makes sense? Okay. So should I get a PSA test? Depends. Age 50 to 75, understand your risks and if your doctor feels it's appropriate. Go into it knowing that there's a lot of false positives. Now, if you get a false positive, that's going to cause stress for you and your family. It's going to cause anxiety, which could cause an increase in blood pressure. So you just need to know those risks. But maybe you're worried about your prostate and that's already causing high blood pressure and concern and anxiety. So it's really up to you guys, up to your doctor and you to personally make that decision. But if you look at the data, it's not saving lives. PSAs aren't saving lives. We don't do them any longer when we go out and do health fairs because it doesn't make a difference. It doesn't save lives. So enough about screening. What can you do to lower your risk of developing cancer in the first place? What do you think is the number one thing that you could do to lower your risk of getting cancer?
Proper nutrition.
That's good. Sunscreen. Perfect. There's a big one we talked about.
Exercise.
Thank you. No smoking. Yes. Yes. Single biggest way you can reduce risk of dying from cancer is to put the cigarettes down and not to smoke and not to do tobacco. I know that's easier said than done, but so because smoking causes lung cancer, we know that, right? But look at all this. Watch this. Am I in your way? I'm just like standing here the whole time. Oh, sorry. It causes all of those cancers, all of those. Plus heart disease. It can lead to heart disease. So smoking is just a horrible culprit and can lead to many, many, many cancers out there. Also, if you are trying to quit smoking, we will have smoking cessation information at this event, but there's also, DHEC has a free program where you can go and get tools that will help you quit. If you need the Nicorette gum or if you need the patch, there are tools out there readily made available for free because we know this is killing our population and we know it's very expensive what people are going through to try to live after smoking for many years. So we want to decrease it. Okay, someone said diet, really important. So lower fat intake reduces risk of prostate and probably breast cancer. There's a lot of information out there about this, not a ton of proof. It's still being studied, but it can't hurt. Less red meat reduces the risk of colon cancer. When you look at processed foods like, I hate to say hot dogs. So don't eat any more. That was your last hot dog. Yes, no bologna, no processed meats or red meat. You can eat red meat, just don't eat a ton of it. Because think about your colon, it's little, and that food has to be processed and has to go through it and has to be processed, and that makes your colon work harder and also can do some damage in there, which opens it up for cells to come inside. So the more you put your colon through, the more at risk you are. And then increased fiber likely protect it against colon cancer as well. So if you're going to eat meat, eat a lot of fiber with it. Right, beans, absolutely. Okay, so exercise. This leads to a decreased risk of colon and breast cancer and to a lesser degree liver, pancreatic, and stomach cancer. So move at a minimum 30 minutes a day. This doesn't mean you have to go out and run a marathon. It means just stand up. Just get up and move 30 minutes a day. A lot of studies have been done on being sedentary and when you just sit all day. That's horrible for your circulation. It's horrible for your body. I mean, I work full time and I put a little sticky note on my desk that says move. And when I'm in the middle of doing something, I just look at that and I run up and down the stairs, or I walk around the building and then go back to it. Just not to be sedentary, because that's horrible. It's horrible. It's not good for your body, and it's not good when you're talking about cancer prevention. Sun exposure, someone said that. So protection against the sun and staying out of tanning beds lowers your risk of melanoma and non-melanoma skin cancers. Now, vitamin D, I get this question all the time because vitamin D is still very, very important and affects your health. So it's important to be in the sun and to get good, healthy sunshine. Just protect yourself. Put on sunscreen, wear a big hat if you're out gardening. Just do it smartly and not bake yourself in the sun. Okay. But you already know all this, right? Because you already said all this, right? Right. But it's been studied, and it's the most compelling way to reduce cancer. Living healthy is important not only for cancer, but also for other diseases. I mean, good health, if you don't have good nutrition, it could lead to diabetes. If you're not exercising, obviously it can lead to poor circulation problems, even lung issues. So not only following this will help your cancer risk, but quality of life as well. So now there's vaccines. Now, I don't want to get into a discussion about controversial vaccines at all. I will premise this with saying this is very controversial, but data shows that it works. There is no reason that 15 years from now someone should get cervical cancer because there's a vaccine for it. For HPV, which is the majority of cervical cancer, is HPV based, we now have a vaccine for it. And it's given free of charge. You have to get it as a teenager, as a young adult. If you're a child, I think a daughter 9 until 16 and sons 11 to 16.
That's all?
Yeah,
That's the only age group?
you can give, it's recommended, you can get it a little bit in the 20s. You just can't go past the 20s, it's not gonna work.
You're talking to the wrong group.
But you have grandkids, but you may have grandkids. You got to tell them. You got to tell them. Because why it's controversial is some people don't like vaccines, period, but a lot don't want to talk to their kids about this because they don't want their kids to have sex. Now, because I go and get a vaccine, doesn't mean I'm going to have sex. It just means that I'm protecting my body from a virus that's already inside of me, that when you have sex, when you're 40 years old and married, it can come out. That vaccine can, that HPV can become rampant.
Good ads on TV now where the kids say, "Did you know that, Mom?
Exactly.
Did you know that?"
Those are horrible. They're sad. Yes,
Yes,
they are.
That really hits home.
It does. But I know this isn't for this group, but if you know people, please encourage them to get this vaccine. It can save lives, and people still die from cervical cancer, and they shouldn't. They shouldn't. So this is really the first vaccine that we know of that's out there and that's working. So summary, cancer screening and prevention is important. High chance of cure, low chance of side effects. Mammograms and colonoscopies have the best track record. That lung screening is still great. We're at 20% there. We just need more people to take advantage of it. Well, there you go. That's what I said. And no great blood test for picking up cancer. Smoking cessation. Number one thing we can do, right? No smoking, no tobacco usage. Healthy lifestyle is the best prevention. Test what you hear against common sense and reputable sources. Guys, if eating honey every day cured cancer, nobody would have it, right? Or putting cinnamon on our food. That may be important, and there may be someone somewhere that's worked for, but it's not going to cure cancer and it's not going to prevent cancer. So continue to do it if that makes you happy, but also follow the other things that we've talked about. The most compelling treatments are the ones backed up by thousands and thousands of patients tested. And that's what we shared today. Lastly, if you're diagnosed with cancer or know anyone that is, we are here, the Cancer Association of Pickens County, to offer that free financial help, free wigs, free hats, free turbans, free supplies, anything cancer patients may need. Are there any questions? I know that was a lot of information. Yes.